Acting Secretary Beam, I appreciated your statement with regard to working with the General Assembly to distribute federal dollars that are coming into the state. And this question is related to federal funding, specifically with regard to COVID-19 testing for K-12 schools. And I know that the Biden administration has set aside an additional $10 billion for testing in K-12 schools. And I'd like to get some information for you with regard to what the guidance will look like and how that money will be distributed. And the state departments of health collectively across the United States are supposed to administer the program, and we have been told that you have received your guidance from the CDC on April 9th. But to date, the department and the governor's office have not released anything yet. So I'd like to know what Pennsylvania's share of that $10 billion from the federal government is, and where you are on developing the program guidance for our schools. And I have some fear. You know, our school nurses are amazing people. They do a lot of work in making sure that our children have their medications, that they take care of our kids who come to school sick. But I just fear that one nurse who has so many other things that they have to do, I don't want to find them having to also administer this program as well. So could you share, again, what our state share of those dollars are, where you are on developing that program guidance, because our schools are going to have to get some things set up.
Absolutely. So, Senator, I hope, and it should be attached to our testimony, we provided the spreadsheet with the breakdown of all of our COVID-19 federal funding that's coming in. And so the line item that's specific for school testing is $337,448 million. And so, sorry, let me be clear on that. $337,848,000, apologies. And so what we have, I first want to also say, we are wholly supportive of our school nurses, and actually very much so want to make sure that this is not an increased burden on them, and rather looked at as an ability to really invest and provide additional resources for, again, another population of clinicians that is absolutely strained, not just during pandemic times, but at all routine times as well. With that being said, our team right now is finalizing a budget submission that has to go to the federal government, I believe, tomorrow. And so we are trying to, as you know and you mentioned, we don't have much time. When we have huge amounts of money, $337 million, that is, again, an opportunity, and we're excited about it, to be able to design that spend and turn it around by April 23rd has been a true labor on a lot of our team, but we nonetheless have put forth a plan by which we will be able to not only have the proliferation of testing in our schools, but in a way that is supportive of our school nurses and not at all further taxing on them. After we're able to submit it to the federal government, they're going to have approval of it, and I'll check with our team on exactly when we can start sharing what that is, but I think we want to make sure that it gets approved before we're sharing it more publicly, because we don't want to get out ahead of ourselves. And so I will follow up as quickly as I can with letting you know some of the breakdown of how we intend to spend those dollars, but I just wanted to clarify conceptually, this is not going to be an additional burden on school nurses. Just, it's the exact opposite. We want to make sure that we're able to support them through these dollars.
Well, and that's very good to know. And I do appreciate expediency, putting on that old school board director hat, knowing that if, you know, in York County, they would partner with WellSpan, or they would partner with UPMC or Quest Diagnostic, or have any other entity come in and provide that service. They're going to have to go through their due diligence and their process to sign contracts and all those other things to make sure that the program is in place in a timely fashion. So that would be very much appreciated.